Good evening. I'm Rachel Sachs, Senior Director of Education and Programs at the Cancer Support Community. Welcome to our live webinar today. For those of you joining us for the first time, let me tell you a little bit about the Cancer Support Community. For more than 40 years, we at the Cancer Support Community have been a relentless ally for anyone impacted by cancer. We help individuals manage the realities of this disruptive disease and get back to normal. Whether accessing our free services in person or at one of our nearly 200 locations online or via our toll-free helpline, you are getting a team of licensed professionals providing patient navigation, financial counseling, genetic counseling, pediatric support, and much more. This evening, we're going to discuss the mental health impacts of head and neck cancer. We have partnered with Head and Neck Cancer Alliance to bring you this webinar to better understand the head and neck cancer patient experience and the unique mental health challenges of this cancer diagnosis. I'm extremely grateful to have with us today a nurse practitioner, a social worker, and a survivor who will help us understand head and neck cancer, the head and neck cancer patient experience, and unique mental health challenges of head and neck cancer, and how to best care for mental health concerns of both head and neck cancer patients and their caregivers. We are joined today by Laura Rhodes, Emily Mady, and Candace Suarez. Laura is a senior social worker at the Sidney Kimmel Cancer Center at Thomas Jefferson University in Philadelphia, my hometown. She received her BS in psychology from Penn State University and an MSW from Rutgers University. In her current role, she provides psychosocial support for the senior adult oncology, head and neck cancer, lung cancer, and cancer genetics clinical teams. She's a trained tobacco treatment specialist as well. Laura also is an instructor for the Temple University School of Social Work Continuing Education Program. Prior to her current position, she worked in continuing medical education, developing education programs for physicians, nurses, and social workers. Being a social worker for over 30 years, she has presented locally, nationally, and internationally on psychosocial issues facing individuals with cancer and their families. Emily completed her BSN at the University of Pennsylvania, also near me, and her MSN at the University of California, Los Angeles. She's been a nurse practitioner at Thomas Jefferson University since 2015 and works with patients who have head and neck cancer as well as lung cancer. Prior to Emily's time at Jefferson, she spent 6 years as an inpatient med-surg RN in Los Angeles, the city where she was born and raised. Emily loves her work and particularly enjoys the complexity of head and neck cancer, as well as building relationships with her patients. Diagnosed with stage 4 squamous cell carcinoma on her tongue's right side in December of 2021, Candace initially underwent surgery to remove over half of her tongue and reconstruct a new tongue from her forearm skin. She had a full neck dissection to remove more than 40 lymph nodes, which thankfully had no evidence of cancer. Candace left the hospital after 8 days with a feeding tube, tracheostomy, and other wounds from surgery, which required care. Her recovery was slow. Candace has devoted her education and career to helping professions as a school counselor, behavioral specialist, and director of school and community behavioral health programs. This background lends itself beautifully to her current work as a life coach and owner of Optimum Growth Coaching, where she partners with both teens and adults. She utilizes what she calls a life drafting approach, believing that life is a series of drafts, each one building upon the last. It's about learning, growing, and refining your path as you gain new experiences and insights. I love that, Candace. She lives in the Richmond, Virginia area with her husband, teenage son, and their two crazy dogs. Please welcome Laura, Emily, and Candace. Thank you, ladies, for joining us this evening. We are grateful for the support of Merck and EMD Serrano and partnership with Head and Neck Cancer Alliance in bringing you this webinar. So let's get started. Emily, can you start us off by describing to us a little bit about what head and neck cancer is?
Sure. Head and neck cancer generally refers to cancers that originate from the squamous cells that line the mucosal surface of the mouth, which is also referred to as the oral cavity, the throat, which you may also hear called the nasopharynx, the oropharynx, and the hypopharynx, and the voice box, which is also called the larynx. There are also head and neck cancers that originate in the sinus or the nasal cavity, as well as the salivary glands, but these are generally rare subtypes.
Okay. Laura, as a social worker for head and neck cancer patients, how do you help the patient and the caregivers as a member of their care team?
So usually I describe my role as a social worker as being in two main buckets. So the first bucket being emotional support. So helping somebody cope with a new diagnosis or treatment, helping them figure out how to communicate with their family and friends around a new diagnosis and supporting caregivers. And then also connecting people with other survivors and support groups. And then the other big bucket is kind of more logistical. So helping connect people with important concrete resources. So things like transportation or financial resources, home health care, those more tangible things that can help make this process a little bit easier.
Perfect. And Candace, can you tell us a little bit about your experience when you were first diagnosed with head and neck cancer and what that was like for you and for your family?
Yeah, it was, the biggest thing I remember is the pain. I had an extreme amount of pain. By the time I was diagnosed, it was Christmas time of 2021. I didn't have surgery until March. I was kind of passed up, so to speak. And probably by January, I wasn't speaking or eating. It was that painful. I was texting with my family. So my family and I would be sitting around and I would communicate by text message because it was so painful. And then I remember my son was 15 at the time. We didn't really tell him exactly what it was until we were sure we had a solution. So that was difficult because I mean everything was kind of disrupted because I make a living from speaking. And eating is one of my favorite things. So to have a diagnosis that I didn't know what the outcome was going to be, whether I was going to be able to speak and eat normally was terrifying. But at the time, it was just so painful. I would have said yes to anything to get rid of the pain. Yeah, I had my feeding tube put in like a month before my surgery, even because I was losing so much weight and wasn't getting enough liquid either. So they put the feeding tube in ahead of surgery.
Thank you for sharing that. And I just
Yeah.
imagine, as being diagnosed with a significant illness, such as what you were, you want to be able to communicate. And that was so difficult and challenging for you.
Yeah.
So you really had to, it sounds like, adapt and learn other ways to communicate and get that level of support that you needed.
Yeah, and I am a social being by nature. So for me to draw back and be home and not comfortable, out in public really at all because I couldn't even speak to grocery checkout person was a complete shift of who I was. So,
Absolutely.
it's almost like I lost myself for that chunk of time for sure.
Absolutely.
And I was on a lot of pain medication too, so it was that additional fuzziness, so to
And this
speak.
was kind of also in the height of COVID, right? So that,
Yeah,
that isolation and
2021.
loneliness. Yeah.
Yeah. So every time I had to have a procedure, I had to go to a drive-through COVID test, like 24 hours ahead of time. Yeah. Mhm.
Wow. Wow. Thank you for sharing that.
Yeah.
Emily, can you tell us about what some of the treatments are that are commonly used to treat head and neck cancer?
Yes, there are a variety of treatment options, and the exact therapy plan will depend on the stage of the cancer or how advanced it is, the type, its location, and a person's health status or their comorbidities. Um, Treatments can include surgery, particularly if it's early stage. It can include radiation, chemotherapy, immunotherapy, or a combination of some of these. The goal of treatment is to maximize effectiveness in fighting the cancer, and in a lot of cases, hopefully to cure it, but it's also to preserve or to improve the patient's functional status as much as possible. So, we always have to balance the benefits and the risks of each treatment type. So like I said, surgical resection is often used for early stage cancers. For more advanced but still localized tumors, we may use a combination of chemo and radiation on its own or in conjunction with surgery before or after. If the cancer has unfortunately metastasized at diagnosis or with recurrence, usually systemic treatment with chemo and or immunotherapy can be used.
Okay. And can you also touch on HPV? And does an HPV positive, if you can explain to us what that is, and if an HPV positive diagnosis, does that matter and influence treatment at all?
Yes. So, amongst risk factors for head and neck cancer, HPV, which is human papillomavirus, particularly a strain called type 16, is a major component in causing oropharyngeal cancer. And HPV is a very common, it's thought of as a sexually transmitted disease, but it's very common in the population now. And down the line, like many, many years after, getting this virus, you can develop oropharyngeal cancer. It does make a difference in treatment planning because HPV 16 cancers are more responsive to chemo and to radiation, and they generally have better long-term outcomes. So if we know a patient has that marker on their tumor, we can sort of, make a more confident decision about our treatment plan. Our hope is that with the increase in HPV vaccine use, that maybe the next generation will not see as many HPV head and neck cancers.
Okay, great. Thank you. That's really important information for all of us. Candace, so you touched on a little bit about your treatment, but can you tell us about the course of treatments that you had and that you received for your diagnosis and what that looked like for you and your family?
Yeah, mine was not HPV. Mine, they did not have clear margins after my removal of the tumor. I guess the location of it, he was not able to get clear margins. So I did have radiation. I have 33 doses of radiation and chemotherapy, cisplatin chemotherapy. So that was through July of early July, mid-June of 2022 was when I was completed with that. Radiation is not pleasant. I would say I was starting to eat some things by mouth prior to that all starting. And then with chemotherapy, I wasn't hungry. And with radiation, it was progressive. So I was good probably 3/4 of the way through. And the last 2 or 3 weeks of it and 2 to 3 weeks following was so painful. And a lot of mucus buildup is what I experienced from radiation. So I didn't start really eating by mouth until maybe September.
Wow.
Yeah, September. So surgery in March, radiation, chemo. Started to really eat. That was challenging. I had to have some swallowing studies and finally got my feeding tube out in November of that year. Yeah.
Well, my next question was going to be for you, what are the challenges? And you really touched on that really, really, really well for us. What I would ask both Laura and Emily and you, Candace, is with that, when who were really some important with those eating challenges, members of the healthcare team for you? I would imagine that the dietitian / nutritionist was really key and instrumental, and your nurses. And if you can touch on those really key critical members for you during that time.
I had my nutritionist cell phone number and could text her. She was wonderful. I to this day don't make smoothies for myself because I'm up to here with smoothies. I exhausted all recipes and on that shake. Speech therapy was also really good. He gave me a lot of swallowing exercises. I mean, I was very motivated to get my life back. So I was pretty diligent about that kind of stuff. So I did my swallowing exercises. I tried to eat as much as I could. So I was a speech and nutrition. I also had some PT for lymphedema. From my FSS that I still have some swelling when I touch it. So like manual massage there with the from the physical therapist, and then teaching me how to do that myself. So I would say those are my biggest supporters. Yeah.
That's awesome. We love the PTs and OTs and the speech therapists and the nutritionists. And sometimes they're the unsung heroes. As a social worker, they were our heroes for sure. And definitely sounds like your heroes. Laura, I don't know if you want to expand on that at all and how you would say that as social workers, you help support and guide patients like Candace through their treatment experience.
Yeah, sure. I mean, just to build on what Candace was saying is that treating head and neck cancer really is a team approach. It takes all of these team members. And I guess one piece of advice that I'll often give to folks is to get these team members involved early on in your care, a speech therapist before you even go to surgery or radiation treatment, just so you can kind of develop that relationship and start learning some strategies for what's to come. I stress to people that this is really individual. There's not a right or a wrong way to feel. What you're feeling is what you're feeling. And I ask people to tell us when they're struggling, whether that's emotionally, physically, financially. Emotional side effects, things like anger, worry, sadness, are just as important as things like pain or difficulty swallowing. And we just don't want people to suffer in silence, because oftentimes there are things that we can do to help. For some of these more emotional effects, sometimes just having a place to say things out loud, like what you're worried about or sad about or angry about, can be really helpful. The things that stay up in our head can take up a whole lot of space. And sometimes just saying them out loud can take away some of that power. I also think it's really important to ask for help if you're struggling financially, which sometimes people can be reluctant to do. You know, the reality is that cancer is incredibly expensive, even when you have the best insurance. There's increased costs like prescriptions, transportation, parking are coming when oftentimes people have a loss of income. So, you know, the math doesn't add up. And sometimes there are grants or other types of financial assistance that's available that if you don't ask or just assume that you won't qualify, you won't know what's available.
That's right. That's right. And you're absolutely right. The entire team is so key and so important, and everybody really, supplements one another, and it's the team approach. We can't do it alone. Sure. And I would love to also call out, and Laura and Emily and Candace, if you've had the experience of interacting, another really key important member that I found in our care team was, and another unsung hero was the oncology pharmacist. Who knew so much about, and it was the team's best friend and the patient's best friend about pain management, and really provided that education, like you said, Laura, really early on in the process, right?
Right.
Yeah.
Yeah. And also, I guess one team member that we didn't mention is a palliative care specialist. They're in our center, we call them supportive medicine doctors. In other places, they're called quality of life physicians or pain management specialists. I think that's another team member that's good to get on board early on, so that you have a relationship already. And if you develop side effects down the line, it might just be a phone call, rather than a new patient visit.
Perfect. Awesome. So this is really for all three of you. If you can talk about the side effects that may result from treatment for head and neck cancer, specifically the physical side effects, as well as the mental and emotional side effects, which we'll address later. Emily, do you want to start?
I can go ahead and start. Now, Candace touched on this earlier, but it really affects the day-to-day functioning. Depending on the treatment, patients can have difficulty with chewing or swallowing. Taste changes are a huge one, especially with radiation and also with chemotherapy. Loss of hearing with certain chemotherapies, difficulty with speaking, pain, dry mouth, and also increased secretions in the mouth, changes in your physical appearance, tightness in your jaw. While you're on chemotherapy, you might have changes in your bowel habits. You could develop peripheral neuropathy, which is numbness and tingling from nerve damage in your fingertips and toes. And nausea and fatigue are also big ones. Some of these are temporary while on treatment. Some are more long-term or even permanent effects. And, when you really think about what you do in your daily life without even thinking about it, eating, communicating with people, working, speaking, and, the list goes on, all of those become challenges for patients who are going through head and neck cancer. Pain really can make somebody feel very isolated. If you're uncomfortable, you really don't want to interact with the rest of the world. And so I agree with Laura that the supportive medicine team is invaluable in helping patients get through the cancer journey, and they can help make you more functional as well.
Absolutely. And we want to stress to our listeners, both caregivers, patients, healthcare providers, to always encourage your patients, in that shared decision-making process, and that the supportive care or palliative care specialists really can be so instrumental in that pain management very early on. So, ask for every member of the team possible is what we would encourage that could potentially help through the process. Candace mentioned, Emily, lymphedema. Can you just tell our audience a little bit more about what that actually is and go into that a little bit?
Sure. So lymphedema occurs typically after either radiation or surgery where the lymph nodes in your neck are affected and they can no longer drain fluid like they normally should. And what can happen is you develop swelling in your neck. You know, some people call it like a turkey gobble because it just kind of hangs there, and it's fluid. Some patients, if they don't know to expect it, can become very concerned that it's cancer coming back because that's often how they present, with some sort of lump in their neck. So I think it's important that patients sort of, you know, are told ahead of time if they're going through either radiation or surgery that this can occur. And it usually requires pretty regular therapy that can be done at home or through a physical therapist where the fluid is manually massaged. And unfortunately, it's a pretty long-term effect.
Gotcha. Great. Well, it's good to know that if that does happen, that there's definitely specialists out there like our physical therapists who can assist. Candace, anything else you want to add about that for you?
I would say immediately following surgery with a trach, that I didn't have it for very long, and I am so thankful for that because that was terrifying. Just the whole idea of it possibly clogging. I remember that was the most difficult thing for my mom came and stayed with us and my husband. So my mom and my husband were worried about having to suction that was probably their most terrifying part. But luckily it was fine. But I would say longer term, the speech is difficult. I either have dry mouth or I am always sucking my saliva in. I have to use gravity oftentimes to help me swallow. So I'll either have to suck it in or put my head back to swallow. So at nighttime I have dry mouth, but usually during the day it's more of an excess. Yeah.
Okay. So let me get into one more question and then we're going to talk a little bit about our discussion tool. But this is really important. So this is for all of you. Why is mental health an important component of the care of head and neck cancer patients and caregivers? So Laura, can we start with you?
Sure. And I think it's for many of the reasons that Candace and Emily mentioned, that a lot of these side effects or symptoms of head and neck cancer and its treatment impact the things that help you to feel like yourself, you know, our appearance and our voice and things that connect us socially to other people, you know, your ability to talk or share a meal. And this is understandably really distressing and can sometimes cause issues on a broad spectrum, you know, from sadness that might just come and go all the way to a major depression or occasional nervousness, all the way to anxiety that really can keep you from enjoying the things that you doing the things that you enjoy. And I think that piece of this is what makes head and neck cancer really unique.
I always say that I'm not the kind of person to stay home and be quiet. But my biggest anxiety was when I had to start going back out again. And I tell people always, but it's not random cashiers and stuff, but when I am meeting someone professionally or personally for the first time, I usually share it with them, but I don't want them wondering why I speak the way I speak. So that is that extra hurdle I have in how to do that in such a way where I'm not seen as trying to like put people on. So I try and make a joke about it, or I say, "Hey, I did something let me know, I'll repeat myself, is usually how I handle it. But the re-entering was probably one of the most difficult things.
For sure. And can you touch a little bit, Candace, on about the overall experience in terms of, I think you've touched on about, your mental health and how positive a person you were before the diagnosis, and you are. Absolutely, we can see that loud and clear. And so not only did it affect your mental health because of everything that you shared, but I'm imagining that also you talked about your mom and your spouse and your son, and how that affected them as well.
My mom, well, I'm from Pennsylvania originally and live in Virginia. So my mom came and stayed with me immediately after surgery, and then she came back again halfway through radiation to drive me and stuff, because chemotherapy is exhausting. I was falling asleep. But I would say, I mean, my family, I feel like my husband was very supportive, but was very distant and uncomfortable with everything. I think he was more terrified of everything than I was. So that has taken a long time to, come back again from that.
Sure.
But yeah. And my son, my son is very resilient and very a big personality. So he handled it well. He interviewed me for a school English project and wrote it all out. So for me to see some of his thoughts and feelings of it was good. For him to write that out, and I thought was really good for him. Yeah.
Great. I want to touch back on something after we take this break and discuss this discussion tool. But please don't let me forget when we come back to talk about the caregiver experience, because you brought that up a couple times, Candace, about the fear in terms of changing your trach and working on that, and the concerns that your partner had, which caregivers do have those concerns. They're not typically trained nurses or healthcare professionals. So I absolutely want to focus on that reality when we come back. But we're going to take a quick break. And we have put in the Zoom chat, and we're going to put in again the discussion tool that we developed. And we would like to request some additional survey information from the audience. So we're going to take a quick pause, and I'm going to have my colleague Marcy come in and share some information about this educational resource that we have developed on the topic of head and neck cancer and mental health. Marcy?
Hi, everyone. So I just wanted to hop in here, and I'm going to share my screen briefly. One moment. And some of you may recognize this once this comes up. So you should be seeing this PDF on your screen. This was developed alongside this webinar for patients, caregivers, survivors as well, to talk about mental health across the head and neck cancer experience. And some of you may have seen this on the registration page or in an email that was sent out within the past week or so. So I wanted to pose to you all, if you're able, and we're going to pop a poll on the screen here. If you could complete a few questions. If you did have a chance to actually review this discussion tool, we would love your feedback on it. And this piece will also be made available on our Cancer Support Community Head and Neck Cancer webpage in the coming weeks once it is finalized, but wanted to just share this with you all as an additional kind of companion piece to this webinar. And if you don't share out either, you can view it online on our website, like I mentioned, but also download it for free as well to share out to other folks and your patients if they would be interested. So with that, I will stop sharing. And we can hop right back into the rest of the discussion. Thanks, everyone.
Thanks, Marcy. So we're going to talk a bit about caregiving. And Candace, you really shared just some really critical things about the caregiving process. And, you know, there's so many emotions when one of your loved one is going through, a significant chronic illness. But with your particular illness, there was also really some hands-on, tangible tasks that your loved ones had to assist with. So, do you want to tell us anything more about that? And then I would love to hear from Emily and Laura about how we support our caregivers.
Yeah, so I mean I came out with a trach, that was the biggest. But then I had the feeding tube I was used to using, luckily, in hindsight, because I had that beforehand. But I also have a pretty extensive skin graft on my forearm and my thigh. So those wounds needed to be changed and treated. I needed help in the shower at nighttime. When I still had the trach, I had to have it almost like humidifying. So I had this contraption. So I had to sleep upright with this contraption to humidify. So I had a bell that I rang for them to come help me at night, get up and go to the bathroom. So, it was definitely challenging for them. They did not talk to me about it at all at the time. I'm sure they talked to each other, but so I honestly don't know how difficult it was for them, because that was not something they were bullying me with at the time. Yeah.
Did they go to support groups or have they gone to support groups since?
No.
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 Yeah. So Laura and Emily, if you can talk to us about the caregiver process, particularly with a head and neck cancer diagnosis and the physical tests that Candace described so well for us that caregivers might have to undertake. But on also those, mental health challenges and that change in relationship. And then it sounds like what Candace is, saying, that they didn't really reveal any frustration or concerns, and they just did what they had to do, which a lot of caregivers do, but that's difficult.
Yeah, for a lot of patients and family members, this may be their first time experiencing any sort of major medical issue. And it's a very steep learning curve, particularly with head and neck cancer. Just the treatment schedule alone can be very rigorous. A lot of patients have radiation, 5 days a week for 6 or 7 weeks, coupled with once a week chemo and provider appointments and labs and scans, and even just the logistics of getting an individual from point A to point B at the right time is a full-time job. And in addition to that, many patients do require feeding tubes, which is a whole learning experience in itself. A lot of patients and family members struggle with how to even get enough nutrition in while they're juggling multiple appointments during the day. It's very difficult for somebody to watch their loved one go through this and feel like they might have to be the strong one, even though it's can be very difficult for them as well. So, I encourage caregivers to seek support for themselves and self-care. And, our social worker is always a wonderful resource to refer people to support groups just like this one, or transportation assistance grants, particularly when people have to take time off of work to help their family or their loved one.
Laura, would you like to add anything? And if you can talk about any additional resources that you want to call out?
Yeah, so I think just from a practical standpoint, a really important question to ask early on is, who do I call when I have a question? And is there a different number to call after hours? What are the things I should be looking for? When is it important to reach out? I think we underestimate like how much we really ask caregivers to do today. And I've seen just in the course of my career how much that has changed, because things that are done on an outpatient basis now are things that people used to be hospitalized for. So like Candace said, things like trach care or wound care after surgery or skin care during radiation treatment. Home health care can be incredibly helpful. Most insurances will pay for a visiting nurse or a home physical therapist or a home speech therapist to help provide, teaching at home when you have some of these skilled care needs. And sometimes I think that can be an underutilized resource. But, like Emily said, I think it's sometimes easier said than done, but it's important to take care of yourself as a caregiver and to give yourself grace. There are going to be times when you feel frustrated or tired or overwhelmed, and that you allow yourself to ask for help when you need it.
Absolutely. We're dropping in the chat lots of resources that we have a cancer support community, and we have all around the country, local Gilded Clubs or cancer support communities. I definitely want to call out our partner on this, Head and Neck Cancer Alliance, who has amazing resources and support services also for our head and neck cancer patients. Laura, can you touch upon, besides support groups, because that's not everyone's, thing, what other support services, if a caregiver is really feeling stressed and needs an outlet, who they can go to?
Yeah, so obviously I'm going to say your social worker in your cancer center. Ask your if you haven't yet been connected with a social worker, ask if there's someone available for you to talk to. And I think for both caregivers and for the patients, connecting with others who have been through what you're going through. If not in a support group, then there are many one-on-one peer matching programs. The Head and Neck Cancer Alliance, Immerman's Angels, can be really helpful in allowing you to feel heard and understand, less isolated. It can be tough though to ask for help and to accept help. I usually suggest to people that they be really specific about what is and what isn't helpful. If you're feeling depressed or anxious, sometimes there can be a role for medication to help. So I think that the big thing to remember is it's not a one-size-fits-all situation. So, and what works for one person might be different than what works for someone else. So it's good to have lots of different tools in your toolbox.
Absolutely. And I think we want to also stress, right, Laura, that these services are there even once treatment is done and once we've entered the survivorship stage. So these support services, because sometimes, right, caregivers are doing that fight and flight, and they're doing what they have to do. And it's not till after the experience, both with patients and caregivers, that sometimes they take a breath and they say, wow, I'm burnt out and I really need support now.
I think that's particularly true for head and neck cancer too, because the road to recovery isn't always a straight path, and side effects can pop up months, sometimes years later. It's really common for folks who were like 6 to 9 months out from treatment to reach out to me for the first time, because they're in this space where they feel like, oh, I should be feeling better and I'm not. And how do I cope with that? So yeah, wherever you're at in the path, just ask for help if you need it.
That's right. And the care team's always there for you. They're just a phone call away. Candace, anything else you want to add to this piece?
No, I don't think so. Yeah.
All right, great. So let's get into survivorship. So Candace, can you tell us a bit about what survivorship has looked like for you? What's your new normal?
Yeah, I was very healthy prior to cancer, and I am healthy now. The only medication I require now is thyroid medication, because of it was in the radiation zone, so I was told that was very common. Um, yeah, every once in a while, something will trigger me, and it pushes you back, right? In that patient mode. But for the most part, I'm a life coach. I coach on mindset, and I coach on resilience. And because I feel that I have embodied that all along. My coping strategies have been journaling. I do a lot of writing down and processing in that way. That is helpful for me. And I also very freely tell my story in as many places as I can, as well. I found Facebook groups also. Some of them are terrifying, but and you have to take everything with a grain of salt. But I will jump in there often to offer support for other people that are in that panic stage. So that's what survivorship looks like for me. I feel like I'm facing it head on most days.
I mean, you are an absolute inspiration, and clearly
Thank
that
you.
positive mindset that you had in the work that you were doing beforehand
Mhm.
really helps supplement where you were and how you got through it. And the advocacy that you're doing is just unbelievable. And I think the entire panel would just want to say thank you for what you're doing. Thank you
Thank
for
you.
speaking out. Thank you for your honesty and transparency and helping everybody. And I would definitely echo what you're saying about those Facebook groups, and Google's great, but be careful,
Yeah,
right?
agreed, yeah.
Yeah. And like you said, sometimes those groups and somebody's experience, people want to share their personal
They do,
experience, but
yeah.
sometimes that can be scary. So make sure you're connecting with those people that make you feel safe, and in the right place, in the right zone.
Yeah.
Yeah, yeah. Laura and Emily, anything to add to that?
From a strictly medical standpoint, if a patient has completed a definitive course of treatment, we usually like to see a patient every 3 months with scans for the first year and then space it out as time goes on. ENT is also a big component of care for head and neck cancer patients. They're typically the first point of contact and often the diagnosing provider. And we like patients to see them in follow-up for a direct scope exam every few months, to make sure that there's nothing suspicious, that we may need to biopsy or keep a close eye on. On a broader scope, our hope is that patients regain as much functioning as possible and go back to their life. And sometimes it's hard because there is a new normal and patients have to adapt with things that are never going to be the same. Um, and I think Candace has done a wonderful job in how she's handled her life post treatment. But it can be very hard for patients to wrap their head around that. Some patients years out say, "I still can't taste chocolate," and that's horrible to imagine for somebody like myself who loves chocolate. But our care does not end when treatment ends, and I remind patients that they can always reach out. There's no end to the care.
Sure. Laura?
So just there might be even years down the road where a side effect pops up and you need to revisit speech therapy or physical therapy or talk to a social worker. And that doesn't mean that you're doing something wrong. It's just something that comes up. So again, don't hesitate to reach out and ask.
That's right. And, we really try to stress through the care team and family to have that positive outlook, but sometimes it's difficult to have that optimism. And sometimes there's that anxiety, being fearful of the next scan. And there's all those realities, and everyone's experience is different. So if your experience hasn't been like Candace's experience, know that you're not alone and that there are support services out there for you, tons of mental health support services, people like Laura, Cancer Support Community, Head and Neck Cancer Alliance, the 988 number if you feel like you're in crisis. So you are not alone. We want to support you and help you get through this. So now's a great time to drop any questions that you might have in the Q&A tool. But before we open up the forum for questions, I have one more question for each of you. Is there anything else that you want to make sure that our viewers know before we end our session tonight? Laura, I'll start with you.
So I would just say you don't have to figure this out on your own. And there's not a right or a wrong way to do this. So ask for help when you need it.
Emily?
I guess one thing, that pops into my head is it's never wrong to get a second opinion or a third opinion. I think some patients are so overwhelmed and they want to feel confident in their treatment plan, but they also don't want to feel like they're offending their provider. And from a provider standpoint, we strongly encourage patients to do that, both for their own peace of mind and also because there are clinical trials that may be offered by certain centers that would be of benefit to them. So that's one thing. And the other thing is, if possible, I think it's always helpful to have somebody with you at appointments, especially early on or when scans are going to be reviewed. It's hard for a patient to always absorb all the information during the visit, and sometimes it's good to have a second ear or somebody who can bring up questions that may not, pop up in your head.
Yeah, that's a really great point, Emily. And sometimes, our caregivers who might not be able to come, our key caregivers, there's always friends, things like that. But if they can't come as well, like you're saying, never hesitate to also ask your provider team, can I record something on a phone or recorder or something of that nature? And also, my loved one couldn't come with me today. Can they give you a call? That's always an open invitation. All you need to do is ask. What we would say here at Cancer Support Community, and I'm sure everyone on this panel and our partner, Head and Neck Cancer Alliance, is make sure you advocate for yourself. Ask those questions. No question is silly. Every question is important. And to our patients and caregivers, you should be part of that decision-making process. And Candace?
I would say just that whole, I would just say one day at a time. Because I remember wanting everything to be normal quickly, and it doesn't happen quickly. And that patience and just doing one day at a time and seeing that progress, and before you know it, you have a year and 2 years, and looking back at pictures of myself when I thought I was doing okay, the difference between now and then is is striking. So one day at a time, eventually you will get through.
That's perfect advice. And I just want to stress, one of our viewers stressed something about patients fearing any expression of fear or sadness or lack of optimism that they'll worsen their outcome. but
Mm.
it's critical to express what you're feeling and your needs. Absolutely. That is a beautifully written point from one of our viewers. To be authentic, express what you're feeling. Sometimes the care team won't know unless you express it, and they are there to help and want to help. One last question that came in before we close for the evening. Can somebody or all of you explain more about saying how I can assist my patients and their caregivers with experiencing stigma due to their head and neck cancer diagnosis and side effects? So Laura, I don't know if you want to start with this one about, maybe briefly what stigma is and how we can help.
Sure. So stigma is this feeling of shame around, in this case, around a diagnosis. And it can be a shame that is imagined. It can be a real shame that other people are putting on you. I think that's where connecting with other survivors can be really helpful. I think also too, just having if you feel like you're being met with stigma, having like a little elevator speech about, for example, HPV, just knowing, most people contract HPV infection at some point in their life, and usually it doesn't cause a problem. Some fact like that to be able to give back to people, I think can be helpful.
Emily or Candace, anything?
I think a lot of patients feel stigma just from looking or functioning differently, and it can feel isolating to not be able to, let's say, go to a restaurant and eat a meal with somebody the way they used to, or to communicate effectively, or to have a feeding tube, let's say. It can even affect their intimate relationships, and feeling like their body is not what they used to know it as. And it's very hard. I think that's where the support groups really come into play, is to not feel alone, to feel like there are other people going through the same thing.
Absolutely. Candace?
I guess my biggest one would be the eating in public and the speaking, but I do it anyway. That's all I can say. It's not easy. I'm not saying it's easy, but I do it anyway, because for me, I don't see another choice.
Absolutely, absolutely. And we're so glad, again, that you're on tonight and the advocate that you are. Your clients are lucky to have you, and anybody that comes into contact is lucky to meet you, for
Thank
sure.
you.
So this was an amazing session. I thank each one of you for your perspectives, and I thank everybody for joining this evening. Thank you for joining our webinar on the mental health impact of head and neck cancer. Thank you to our sponsor, Merck and EMD Serrano, and partner, Head and Neck Cancer Alliance, for their generous support of this event. And this event has been recorded and will be made available we're going to put in the link where it will be made available, and it's usually available within a day or so. So we will put that link in really quickly, but we thank everybody for joining. We wish you good health. We wish you support for yourself, support for your loved ones, a happy, healthy, and safe holiday season. Marcy, anything to add?
I just wanted to quickly call out the poll, I believe, that also popped on your screen for the webinar today. If you could leave your feedback on how this went for you and additional feedback, we'd love to hear it. And just want to thank you all for your time.
Thank you, everybody. Have a good night.